Welcome to Business Innovators Radio, featuring industry influencers and trendsetters sharing proven strategies to help you build a better life right now.
Good morning and welcome to another episode of Business Innovators Radio Network. My name is Terry Palma and I'm the host of this episode. And our guest this morning is Susan Lawrenson. Susan, you there?
Yes, I am. Thanks, Terry.
Yeah, fantastic. So Susan is a licensed acupuncturist in South Carolina, and she has just recently joined Carolina Health Innovators, which is a chiropractic center, and they're branching out and bringing other holistic techniques to his service. So tell me a little bit about yourself and how you got at Carolina Health Innovators, Susan.
So I've been in this holistic health field for 27 years. I have lived in the Greenville area for 3 years, and recently, before that, I was in Asheville, North Carolina, teaching acupuncture, and I was looking for a center that had different modalities, and Dr. Ken is really thinking outside the box and is having a couple other modalities, not just chiropractic, not just acupuncture, but even a massage therapist in his office. So that's how I found him.
Fantastic. And how long have you been with him?
Just a few weeks.
Great. Okay. So tell our listening audience, I know about acupuncture. We might get into that a little bit later, but tell our listening audience exactly what acupuncture therapy is and how it can help them and benefit in their health.
Sure. Well, acupuncture, most people know it's thousands of years old. It's so humbling to pick up some of the texts that I've studied from and literally see what dynasty some of the points were thought up in what dynasty. So it's thousands of years old. And we look at the body as a whole. So why you have a headache, you may think has nothing to do with food or diet, and in some cases with women, maybe even their menstrual cycle. So we look at the body as a whole. So basically, that's kind of what we're doing.
So you mentioned something that our listening audience, that our listening audience might not understand. You mentioned points. Can you explain what you meant by points?
Sure. So acupuncture is a system that we think of, let's just say, as highways in the body. And there's 14 highways in the body. So imagine this big highway system. I think of an LA highway system, which lots of cars and lots of concrete, and all these roads are going all different ways. And think of your body like that. And the acupuncture points are literally the gas stations on the highway. So they're the points that are going to maybe give you more energy or move the energy to a different side of the highway. And those are what the points do. Maybe take out less energy. Maybe you have a headache and it's a pounding headache. So we're going to move that headache somewhere else. So those are the acupuncture or acupressure. They're the same thing. One uses needles and one doesn't. So those are the points.
And so how do you use those points? What actually are you doing in a session? What can a first-time person experience when they have acupuncture for the first time?
Well, the first time, it's usually an hour and a half session. Sometimes it can even be 2 hours. And we really spend a lot of time with our patients. You may come in for back problems, and we start asking you everything from maybe your diet, what are you eating, your lifestyle, are you exercising, and even we get so far as, what's going on in your life. Are you stressed? Are you going through something at work? all these questions, we put together a puzzle, and we try to figure out why. We get to the root of the problem on why do you have this backache? And yes, maybe you did fall, and we can treat that. But really, why is it that you have this problem? Are you having problems at work? Are you having problems in your marriage? And that's what we look at, the body as a whole.
Interesting. Almost sounds like therapy.
Well, we always laugh when we got out of school that we should have gone for our licensed therapy degree. Listening to people. I mean, people are surprised when they come to see us that they'll say, "Wow, no one's ever talked to me about these issues," or, "Wow, my doctor spends 3 minutes with me, and he would never know that I have a headache and I'm going through a divorce." I mean, to us, that makes so much sense. Or I was in a car accident 15 years ago, or I had some type of abuse in my childhood, and we look at that as a whole, and then try to figure out. We figure out a treatment plan. We figure out the puzzle, and try to figure out what the next step is.
Right. Well, that makes sense. So you mentioned points, and then you mentioned needles. So can you tell me, is the process, I'm assuming with the acupuncture then, you're using needles on these points. Is it painful?
So that's a great question. No, but let me just back up a little bit. So most people have their idea of a needle is some type of an injection, whether it be a shot, a B12 shot, or just some type of shot. And I have to tell you, those hurt. I mean, I had a shot once that days later my leg was still numb. I'm like, oh my goodness. So with acupuncture needles, there's no medicine in the needles. There's nothing in the needles. So the needles are very, very fine. They're like a hair. You can put 14 acupuncture needles in one injectable needle. So think about that, 14 needles in one injectable needle. So no, they don't hurt. And sometimes there's a point that might have a little bit of a ouch, like a little sting, but people say it's a bee sting, and I've had a bee sting. It's nothing like a bee sting. It's just kind of like an ouch. And they don't hurt at all. And for anyone who has ever had a tattoo, it is nothing like getting a tattoo. Like people say, oh, I'm afraid of needles, and they'll have a tattoo on their body, and I just laugh thinking, yeah, it's nothing like a tattoo. So no, it really doesn't hurt. But imagine a needle that has nothing in it. It's just it's so small and fine.
Wow. So besides maybe the fear of a needle or pain, what are some other misconceptions that someone who hasn't experienced acupuncture might have that you can help relieve, that these are myths and they don't happen?
Sure. So the biggest fear for people is, like you said, the needles, which if you can get over that, I mean, I used to treat a lot of children, and children come in, and that's their biggest fear, and then I put a needle in them, and they start laughing because they think there's nothing to it. And the other big fear, which I think in the last 10 years has kind of gone away, and with that being said, someone just asked me it yesterday, is do you use the needles over and over again? And I think that was more 15-ish years ago, people asked that question because of all the HIV concern. And now I get that question very, very rarely now. And I think that was and still can be an issue for people, that the needles we use them again. We do not use them again. They're prepackaged and sterile, and we throw them away in a biohazard container after each treatment. And then just the comfort level. Some acupuncturists are different, but we have usually a private room, and it's comfortable. It's kind of somewhat like a massage room, very comfortable, nice and warm, and very private and very comfortable. So those are usually people's biggest fears with getting acupuncture.
Well, as you know, I've tell you about my experience, and just as a little backstory to our listening audience, to reiterate that the pain factor is not there. When I was in my 20s and I was in UCLA, I had 4 teeth that needed to be drilled, and someone had told me that there was a Chinese dentist in Westwood that would do acupuncture instead of Novocaine. And I did. I had 4 teeth drilled with acupuncture, no Novocaine, was eating dinner that evening, and so I can attest to the fact that it works. It's fantastic. So, Susan, give us a little bit more about your backstory. What inspired you to become an acupuncturist, and the whole thing? Please give us that.
Sure. So I first started off as a massage therapist and absolutely loved it. I loved massaging. I met the nicest people throughout the world. I had my own private practice, but I worked at a 5-star spa, and absolutely loved it. And then one day I decided to go back to school and get my holistic healthcare certificate, and that included nutrition. And there's so much growing in this. There's always another step to this, and I love the nutrition part of it, and I do that a lot in my practice. But one of my teachers, Dr. Carlos Santos, knew that I had suffered from urinary tract infections my whole life. I think at that point I had 4 surgeries as a young adult and a child, and I always say that I spent my childhood at Children's Hospital. When the wind blew wrong, literally, I would get another urinary tract infection, and I was on Keflex and Macrodantin and antibiotics most of my life. And he said to me, next time you get a urinary tract infection, come and see me. And I thought, you've got to be kidding me. So sure enough, months later, I got a urinary tract infection, and I don't know what made me do this, but I ended up getting a treatment from him. And I thought to myself, I know I will be at the hospital by tomorrow. I just know I will be, because that's what happens. My fever gets really high. I need to get on an IV ASAP. So no herbs. This was no Chinese herbs with this. This was just acupuncture. And he said, you will go home tonight and have an unbelievable sweat. Like you will wake up in a pool of water. And I thought, I don't sweat, so this should be interesting. And sure enough, in the middle of the night, I woke up, had to change the sheets, and woke up the next morning, and I could have gone to work. I felt fine. And it really was absolutely, well, it was mind-blowing to me, because I did not get on any herbs, any pharmaceuticals, and I felt fine. So that was how I was introduced to, and by the way, while I was lying there, I thought this was the craziest thing I had ever done. And like I said, I kind of had my route planned the next morning to go to the hospital, because that's what I used to do. And a couple weeks later, got acupuncture again for a little knee problem I was having. And then I changed my whole life path and said that was it. I'm going back to school to do this. So that's how I got into it, kind of by mistake, but it changed my life. And since then, once in a while, I call it getting tweaked, meaning once in a blue moon, I'll say, yeah, let's work on my kidneys. But truthfully, ever since then, knock on wood, I don't think I've had one. Well, I know I haven't had one major urinary tract infections since then. I've had very, very minor ones, but now I know how to take care of them. So I have not been on any pharmaceuticals since probably 1996, ever.
Wow. So one final question. What can a typical person through a session, how long after a session will they feel the results, or will they feel the results of that particular session?
Sure. So it's amazing. I try never to judge, even though sometimes in the back of my head I think, well, come on, I had a patient once that was in their late 80s and had a shoulder issue because he fell off a horse 40 years ago. And I thought, well, come on, you're not going to be, this is going to take a couple treatments. You've had this for 40 years, really? And I gave him a treatment. He said he felt fine when he got off the table. He's like, look, my shoulder's fine. I said, oh, great. And then I never saw him again, which sometimes happens. And I thought, I'm so sad because he was such a nice man. And actually, he was still working. It was just amazing. And I felt bad, and I thought, well, sometimes it takes a while. Sometimes you have to remember, some people have had these ailments for years. So I thought, well, okay, I'm never going to see him again. Months later, I saw his daughter at an event, and she said, oh, I just want to let you know that my dad, after one treatment, his shoulder was fine. I said, really? So some people get off the table, and I never have to see them again. And other people, and it so depends on so many different variables. Maybe how long you've had the problem. If you're on pharmaceuticals, sometimes that makes a difference on the energy in your body. What's your diet like? Are you smoking? Are you exercising? What kind of health were you in before you came in? So are you a compliant client? Meaning, if I ask you to, maybe do some little exercises at home or maybe put heat on it, are you going to do that? So I'd like to say I know when people walk in, but you know what? I have no idea. Sometimes, like I said, it can be one treatment, and sometimes it can be, obviously a couple treatments.
Okay, that makes sense. Perfect sense. So I want to thank you for, for being on our show today. I don't know what happened. I need some water. And would you give us some contact information for Carolina Health Innovations, the center where they can reach you? I encourage people to come out to give Susan a call or at the office and experience it for yourself. I know I've done it. I have had friends that have done it. And I encourage you all. So, Susan, give us some contact information, please.
Sure. I'm at Carolina Health Innovations, like Terry said, and that office number is 864-288-8593. And you can always Google Carolina Health Innovations, or if you want to send them an email, it's info@carolinahealthinnovations.com. And let me just repeat that number one more time. That's 864-288-8593. And remember, your first treatment will be a good hour and a half or so. So please take time for these amazing treatments.
Susan, are you there on Saturdays by chance? Because some people might not be able to come on the weekdays.
I'm not right now, but later on, as my practice grows, I'm thinking of maybe Saturday afternoons, or even on Sunday afternoons later on in the day.
Well, great. Well, Susan, thank you again for coming. I wish you all the luck. And folks, I know it works. Give her a try. This concludes our session with Susan Lawrenson with the Carolina Health Innovations Chiropractic Center, and she's the acupuncturist, resident acupuncturist. And make sure that everybody treats everyone with kindness and take care. Thanks for listening, everybody.
Thank you, Terry. Thanks, everybody.
Thanks for listening to Business Innovators Radio. To hear all episodes featuring leading industry influencers and trendsetters, visit us online at businessinnovatorsradio.com today.